Could your back pain be caused by having a short leg? Hey, Dr. Chris Gubles here from Square One Health, and today I'm going to talk to you about one of the primary drivers and causes of chronic back pain, and that is having a short leg on one side, otherwise known as having a leg length discrepancy, or having a discrepancy in the length of one leg compared to the other leg. In a recent paper published in the Archives of Physical Medicine and Rehabilitation, the authors found that up to 96% of the general population has an anatomical short leg. Having a leg length that's just 3 millimeters short on one side is enough to cause significant postural shifts and deviations. Having a leg length that's 6 millimeters shorter on one side is enough to cause pelvic tilting and a secondary scoliosis. And having a leg length 9 millimeters or more on one side is enough to cause significant facet misalignment and causing the facet joints to break down and decay on one side. They even found that over 50% of people with a disc herniation or disc bulge have an anatomical short leg. So we know this is a big problem. Now, if you're liking this information, be sure to give us a thumbs up or a like, and comment below if, as you're watching this, you think of other tips and or topics you want me to discuss and to talk about. So what does this actually do? So if you think about the pelvis, if you have one leg that's short on one side, that will cause a tilt in the pelvis. That puts uneven stress and strain on the joints, the soft tissues like the disc, and cause asymmetries in the muscles and how those tissues have to engage in the work they have to do. So this can cause your spine to break down abnormally, it can cause disc herniation and disc bulges, it can cause arthritis, and it can cause radiating pain on the back of your leg. In fact, people that have an anatomically short leg are much more likely to deal with chronic pain compared to those that don't. So we know this is a big problem. But how do we detect it? How do we evaluate it? And ultimately, what do we do to go about correcting it? So when we think about having a short leg and how this impacts someone's spine or how it could be causing back pain, it's having this short leg and how that may cause your pelvis to tilt. That's the big concern. So you have to take a special X-ray that looks at both the top of your femur heads, evaluating for your total leg length or possible leg length discrepancy, and at the same time evaluates the top of the sacrum. The sacrum is the part of your pelvis that your spine actually sits on. So this right here is the sacral bone, and we want to look at this and how that is tilted or not tilted so we know how to correct it to decrease back pain. The problem with this is your sacrum actually tilts like this from the front. So we have to take a very special X-ray that's angled up at about a 15 to 20 degree angle. It's called a modified Ferguson view, and we use that to look at your femur heads, the top of your legs, and your pelvis at the same time. Based on this, we will recommend or order a proper lift to correct the leg length discrepancy and ultimately to level out the pelvis. Now, a lot of providers mistakenly just give out simple heel lifts. This is an example of a heel lift. It's bigger on the side where your heel is and it tapers off. The problem with using a heel lift is it just raises the heel, hence heel lift. It's basically like standing on your tippy toes on one side. That can cause uneven stresses on your pelvis and your sacral joints. It's not the best solution. We want to raise the whole leg without actually causing you to put more pressure on your toes. So we recommend using a full foot lift or insert, and these are ordered by a local orthopedic company that makes custom orthotics. Now, this is tapered, but this can be designed, and it is designed to go inside your shoe and raise the whole side of the leg up. We can do this for leg length discrepancies up to about 10 millimeters. 10 millimeters is the maximum we can put inside a shoe and still allow proper movement and space for the toes. If it gets bigger than 10 millimeters, then we can refer a patient to a local cobbler, and a local cobbler can actually add some material to the bottom of the shoe to make the shoe taller on one side to compensate for the unlevel pelvis. And a lot of times you can't even tell they're doing this. They can make it blend in with the sole of the shoe, and so most of the time you won't even notice. But these are the different things we can do to actually correct an anatomical leg. Now, in children, if they're growing and we lift one side and we take the pressure off that side of the leg and we balance it out, sometimes that leg can actually catch up and it can actually grow faster and the leg lengths can actually be corrected over time. But once you're done growing, we can't correct this. This is just a way that we compensate for the anatomical short leg. Now, is this the only thing you have to do if you have back pain? Probably not, but it's where we start. Most of the time people come in and they have a length discrepancy. There's other things we need to do to address their underlying back pain as well. But this is where we start. This is square one. You have to start at the foundation. You have to get the foundation right, and then we build on top of that. So if you're dealing with low back pain, one of the first things you want to do is you want to check with one of your providers to get your leg lengths evaluated and see if you have an unleveling of the pelvis. Now, if you want to know who to go to, find someone that is Chiropractic Biophysics-certified or Chiropractic Biophysics-certified, because they're going to be the most highly trained specialists to properly evaluate your pelvis, to do a modified Ferguson X-ray, which is the specialized view. You need to evaluate both the leg lengths and the pelvis. They're the ones that are going to be trained to make sure you get the right kind of lift to properly correct this. Now, if you're liking this stuff, be sure to subscribe and follow so you get notified when we make more videos that may give you tips and suggestions to take care of your body, your spine, and your overall health.